With Revive Upper Cervical, and today we're talking about developmental delays. So if you know somebody or you yourself have a child that's having a hard time focusing in school, maybe they've been diagnosed with attention deficit hyperactivity disorder, maybe they're just not hitting their physical milestones yet, they're not speaking as many words as they should, or maybe they're having trouble standing or crawling, and they're just not, maybe they're not integrating socially, they're keeping to themselves, or they're just not very sociable. They may have picked up a diagnosis of developmental delay syndrome, and that's what I want to talk to you about. Because in our work that we do here, and again, the work that we do specifically is known as upper cervical chiropractic, but I would go so far as to say any type of specific chiropractic care, in that work, a very specific work on spinal health, a lot of times we will see improvements in children and young adults that have been diagnosed with developmental delays. Myself personally, I have had a patient that was a full-blown adult that was oxygen deprived at birth. And so he was given a mental delay diagnosis. He was 20-some years old, but you'd think he was basically 2 or 3 years old, right? He had only a handful of words. And as we started working with him, his parents and grandparents noticed all of these new words that he had never said before. And so it's something that we see clinically. And the question is, what is it that's happening? Why is it that a child who's never said a word, maybe a newborn infant or a toddler, 1 or 2 years old, is now saying words where before they never said a thing? What does that have to do with the spine? Well, I wanted to share with you a bit of research that came out last year, probably the very best research in our whole profession in the last 5 to 10 years. It was published in a journal called Neuroplasticity, and it came out of research in Australia, Dr. Heidi Havoc. And it's a phenomenal piece of research. And what they did, the long story short, was they hooked up people to these electrodes on their head, and what they found, along with an independent neurologist researching with them, what they found was when they made adjustments to the spine, right, something we call spinal subluxations in chiropractic, misalignments that affect the neurology of the area. Whenever they made adjustments to the spine, including the neck, what they found was they changed by 20% the function of the prefrontal cortex. Now that's a fancy word, but basically the prefrontal cortex is the area of the brain, in the front of the brain, that controls all of your advanced functioning, all of the things that make you human. So your decision making, your impulse control, problem solving, goal setting, language and speech, all of those higher level functionings. Now what I want you to do is, if you look at this list, we have speech, communication, problem solving, decision making, social functioning, sensory perception, mood and energy levels. And I want you to think about this. If this frontal cortex wasn't working right, what would the diagnosis be for someone? If they have poor speech, poor communication, they don't make decisions very well, they don't have good impulse control, right? Can you see how that might be, someone on the autism spectrum, or a toddler who's acting out, or a young child who's getting horrible grades and has a bad attitude? You see what I'm saying? Now, it's not that this is a cure-all, right? But what we're saying is, if you have a child that's struggling in school socially, struggling academically, a toddler that's not hitting their physical milestones, maybe they've got a spinal problem that's leading to their brain just not integrating communication, neurological communication, the way that it should. And this is research saying we could improve that communication, or an integration by potentially 20%. That's a big deal. So I'm going to post in the comment section of this video a PDF or a JPEG that summarizes this research article, and it's yours to download and keep and have. Maybe I'll put the web link to it, and if you guys have any questions additionally to that, please ask them. And of course, if you know someone that's suffering with a developmental delay or has kids that are suffering with developmental delays, please share this with them as well. We'd love to be a resource to help them find this sort of specialty care that could maybe make an impact in their quality of life. So thanks again for watching, and we'll talk to you guys next time. Bye now.